There's been quite a bit of research showing that ethnic and racial minorities have higher rates of chronic conditions like diabetes and cancer, but also acute conditions like cold and flu and pneumonia. They're less likely to access preventive care, and they have poorer outcomes. What are some of the factors that contribute to this scandal, really?
These are all really big problems that we have in our healthcare system, and it's not always just based on certain minority groups. It's often based on lots of structural barriers that people across the country have as more and more people have problems affording healthcare. It's obviously very expensive. There are structural barriers, we call them, things like transportation problems, getting to offices on time. There's lack of access to doctors. So there's a lot of problems that sort of lend themselves to people not availing themselves of the best healthcare and getting the best quality healthcare. And so it turns into this sort of domino effect where you lose your continuity with your care provider. And so when you have that kind of fragmentation, there's a lot worse outcomes in general. I think that there's other kinds of bias that exist, both within the healthcare system, within physicians. For instance, if there's a language barrier, sometimes physicians and their staff members discount the value of what patients are complaining about or what their needs are because the patient themselves can't communicate well. The Department of Health and Human Services put out a statistic that showed that only 12% of Americans have high health literacy, that can understand a graph and a reduction in risk for a cancer, for a death. We don't do a good job as physicians in communicating complicated information. If you have a lower education level, and potentially from an ethnic group that may have lower education attainment for a variety of reasons, you may not best understand what you should be doing. You may not truly be informed. And that's still a problem that we have as physicians. It's not their problem. We're not doing a good job reaching out to them.